Good afternoon. Thanks, Dina. Thanks to Minister Shandro for today's announcement to help support the continuing care system, including home care, supportive living, and long-term care in Alberta. This is welcome news and very much appreciated. Giving home care agencies the resources they need to allow for the hiring and retention of more staff will help more Albertans receive care at home when possible. Quality care in the most appropriate setting. It will also help us get people home and preserve space in the acute care, especially as we see the number of COVID-19 admissions rise. Home care has faced staffing challenges throughout the pandemic. We saw a temporary reduction in the number of clients receiving home care last year because of COVID-19, which meant staff worked less hours. Some moved on to other jobs as a result, and filling these positions has proven difficult as the home care demand increases again. The wage supplement for home care healthcare aides will assist home care agencies to fill these positions again and extend the number of hours available to support Albertans. Healthcare aides in long-term care and designated supportive living have already received the supplement last year. This increase will help home care be on a level playing field for the home care aide workforce. This funding, as mentioned, will enable home care agencies to take on more clients, which will expedite the discharge of patients currently waiting in hospitals who can be supported at home with home care. In addition, we are looking at different strategies to increase the number of staff available to support clients, including hiring healthcare aides who may not yet have completed their certification but can provide care under supervision while they do so. There are many tasks that can be performed by individuals who are not certified healthcare aides to help people thrive at home. Innovative strategies will also be required to increase the pool of certified healthcare aides available across continuing care, including home care, and we will explore both local strategies and those used in other jurisdictions to increase the number of available staff. Our priority is to provide safe, quality care to Albertans in the most appropriate setting, whether that is in a hospital, long-term care facility, designated supportive living facility, or in their own homes. It is initiatives like these that enable us to continue to provide the highest level of care and support to Albertans. I'd also like to provide an update on hospital capacity. Our provincial healthcare system is experiencing significant capacity challenges. We continue to do all that we can to increase capacity, particularly in our ICUs, where pressure on our staff, physicians, and resources is intense. This afternoon, our ICU capacity is at 87% of all our capacity, including the surge capacity that we have created to date. There are 231 people in ICU. About 70% of these patients have COVID. In the past 7 days, we have added an additional 59 surge beds. We now have a total of 93 surge beds above our baseline of 173 ICU beds. So although we state that we are looking at a current capacity of 87%, remember that this includes surge beds. If we did not create the surge beds, we would be at over 130% capacity. So again, thank you to our nurses, physicians, and all the healthcare team members for helping create these additional beds, which have given us some much-needed breathing room. I cannot overstate enough our gratitude for our people who continue to work tirelessly 18 months into the pandemic. In the face of rising numbers of patients with COVID needing hospital care and our ongoing efforts at the same time to meet the needs of patients who need other non-COVID care, we have to continue to take every possible measure in order to maintain our ICU capacity and increase it wherever possible. And unfortunately, this means that we have to postpone surgeries. Yesterday, Calgary Zone made the difficult decision to postpone all scheduled elective surgeries and many outpatient procedures for the remainder of this week. This includes some non-urgent scheduled pediatric surgeries. We're also having to postpone some non-urgent transplant cases and a small number of cancer surgeries that can be safely delayed for a period of time due to the stage and nature of the particular cancer. These may include low-risk diagnostic cancer surgeries where cancer is suspected but not confirmed. These decisions are clinically based using a triage document written and approved by physicians and clinical cancer leadership. As is the case with all surgeries, clinicians triage cases based on priority. The most serious and urgent cases are performed first. This has happened in previous waves and is standard in every healthcare system in the country. My heart, though, goes out to the patients and their loved ones, because we know it is not easy when you get the call that you need a postponement. The pandemic is having a significant impact on many Alberta patients, not just those with COVID-19. I want to explain why we have to postpone surgeries. Some patients will require intensive care after their surgery. They may have to spend a couple of days in ICU as they recover so that our frontline teams can monitor them and keep them well. This happens in both planned and unplanned ways. We currently just don't have the capacity to provide that care, while also ensuring we have the capacity to look after patients who are very ill with COVID-19, as well as patients who suffer a trauma of some sort, such as injuries from a car accident or emergency like a heart attack or stroke. So we have to postpone non-urgent scheduled surgeries to ensure that we have the space, the staff, physicians, and resources we need to care for those who need it. Postponing elective surgeries allows us to redeploy qualified staff to support intensive care and critical care beds. Healthcare is a finite resource, and we need the help of all Albertans to protect it. The key to easing this situation and returning to normal surgical levels is reducing the pressures on our hospitals. And the key to that is actually known. We need to do all we can do to protect ourselves, our loved ones, and our communities by getting immunized and following all COVID restrictions and guidelines. That means wearing a mask in the public indoor setting. It means staying home and away from others when you feel sick. It means washing your hands regularly. These are the things that will protect our healthcare system and help return us to a place where we don't have to postpone surgeries. The power of the vaccine is clear. Of the 155 patients with COVID currently in ICU, 89% are either unvaccinated or partially vaccinated. I recognize that getting vaccinated is a charged topic right now, and that there are many reasons people have, to this point, chosen not to vaccinate. If you have concerns about being immunized and need more information, we have many experts who can help you with factual information. You can contact us at 811. If you don't want to get immunized in order to protect yourself, please consider getting immunized to protect others. Thank you very much, and I'll pass it back for questions.